The quiet facelift. If you spent any time on my side of the internet, you have seen this term everywhere. It's taken a leading role in facelift marketing, at least across my feed, and I'll be honest, I hate the term, but I understand the message behind it. So today, I'm going to break down what a quiet facelift actually means anatomically, and I'm going to tell you something that surprises almost every patient in my consultation room. The quietest facelifts are the loudest operations. Mine takes 6 hours or more, and they are almost never a facelift alone. Having evidence of a facelift is taboo. It always will be. So the entire game is minimizing the stigmata or evidence of surgery. And I want you to know what those stigmata are, because once you see them, you cannot unsee them. Pulled or pixie ears, windswept cheeks, flattened cheeks, an overly tightened neck, weird creases when you talk or smile, bulges over the buccal space. When I see these, I know a facelift was performed. A quiet facelift is a result that is evident but doesn't make it obvious to your friends or even your family that you've had work done. So here's the paradox. Avoiding those stigmata does not mean doing less surgery. It actually means doing more, and it means doing the right kind of more. Your face is not one sheet of tissue. It's a layered structure, and it is tethered to your facial skeleton by something called retaining ligaments. These are ligaments, or ropes if you will, running over and under the zygomaticus major muscle, which is your main smiling muscle. There are also masseteric ligaments outside the masseter and along the cheek. And there are cervical retaining ligaments in the neck. In traditional facelifts, these ligaments are really not released. And when you pull tissue back against these ropes or structures that are still attached to your bone and your deeper neck, you're pulling against a fixed point of resistance. That is where tension comes from. That is where that windswept look comes from. That's where the operation gets loud. The quiet facelift can only be achieved when you take the extra steps to safely release these ligaments and suspend the tissues in a tension-free but meaningful way. And I want to be very clear, this is not about SMAS work being wrong. SMAS work is essential. It's just that SMAS work against intact ligaments can only do so much. Release first, then suspend. That is the composite deep plane concept, and it is why the operation takes as long as it does. I also think terms like vertical elevation are overplayed. Vertical is not really the direction. When we pull optimally, we're pulling perpendicular to what time and gravity did, and gravity pulls down and forward. So the correction is almost a radial expansion. The nasolabial folds and the marionette lines are not parallel to each other, so the pull cannot be uniform either. In the lower face, my vector parallels the jawbone. In the upper face, it's about 70 to 80 degrees. It's never truly 90. It is a graded fanned elevation, and every face gets its own map. So what does this look like in my practice? My facelift starts at the top of the scalp and ends at the collarbone. When you lift the face vertically, tissue has to go somewhere, and it tends to bunch at the temples. So the majority of my patients also undergo some form of endoscopic brow rotation or lift to recruit that excess and carry it towards the vertex of your scalp. It subtly repositions the tail of the brow, but it really is just elevating the lateral face vertically. This is not unique to me. I didn't come up with it, and frankly, the surgeons who are doing this combination are producing the best results that I personally see online. I use a nerve stimulator in every case. Before I divide any ligament, I interrogate it. The stimulator has a cadence or a pulse, and if that pulse, the electrical transmission, aligns with movement of the face, means I'm too close to a nerve for comfort, and I do not cut that ligament. You've seen the videos, someone 3 days out of their facelift saying how great they feel, with their face really swollen, but they're kind of like blinking with one eye. That weakness does usually resolve, but it's scary enough that I refuse to put my patients in that position, even in the short term. Then, strategic fat grafting to the cheeks, the pre-jowl depressions, the nasolabial creases. It won't make your face fatter. It's padding, cushion. the curvature of a youthful face, the apple of your cheek, rather than just one that's pulled tight over bone. And in the neck, the submandibular gland reduction is important when it's needed too. When it's done aggressively, you tend to hollow out that neck. But if you do it strategically, symmetrically, and in a controlled fashion, you can get a debulked neck that does not scream, "I just had a facelift." No drains are used in my facelifts either, not when they're not necessary at least, and no hemostatic nets. It works well for other surgeons, but the hemostatic net concept is just not for me or my patients. Meticulous hemostasis and a bespoke compression garment are better. I want to be fair to my training because it was good training. I came up under surgeons out of New York who are doing wide skin undermining, real SMAS modulation, and fat transfer. That's not a small operation, and every one of those elements is still a part of my facelift today. But here's what I eventually understood. You can undermine widely, you can modulate the SMAS beautifully, you can graft fat perfectly. And if you still haven't released the retaining ligaments, you are still suspending tissue that is tethered to bone, and you're working against resistance. The elevation you get is the elevation the ligaments will allow you to get in the short term. When I came to California, I adopted a lot of Bruce Connell's thinking, including liposuction of the jowls, which can look excellent at rest, but it doesn't always hold up with speech and animation of the mouth. And in 2023, I really absorbed the work of Chinho Wong and Brian Mendelson in the Asia Pacific community and their composite deep plane facelift concept, where the ligament release becomes the entire point of the operation. My own practice, I feel that was the missing step. It didn't replace what I had learned, but it let everything else I learned finally work. Adding endoscopic maneuvers completed a technique that I don't see changing anytime soon. I'm not a regimented surgeon. I don't do the same operation on every face because every face deserves its own approach. But these tenets are the foundation of my modern facelift, which, as I've famously said, has no name. The Quiet Facelift is not a smaller operation. It's not a mini facelift. It is a bigger one, done carefully enough that only you should know you had a facelift when all the dust settles. If this was useful to you, subscribe to my channel. I've got a lot more where this came from. Thanks so much.